Staying with the coronavirus, the National Institute for Communicable Diseases says there are no direct or clear correlations between the closing or opening of schools and COVID-19 waves. The Institute published a new surveillance report on under-19s, and it found that children and teenagers are less likely to be diagnosed or hospitalized with COVID-19 compared to adults. Well, to help us delve a little deeper into the details of that report, let's speak to a senior epidemiologist at the NICD, Dr. Tendesayi Kufa-Chakeza. Thank you so much for joining us. I think a lot of people were worried that schools were super spreaders. Were they super spreaders, or was it just a case of the teachers being more at risk than the children?
So thank you so much for inviting me to come discuss this report. As you know, children are a very sensitive issue. As parents, we love our children, we live for our children, and we worry so much about them. So first of all, the data that we have doesn't really tell us who's a child, who's in school, who's online, who's not. We collect data on a national level, the same data that you get every day reporting the number of cases. So it's not detailed enough to be able to tell us which of these children that had COVID were in school, which ones were online, which ones were wearing masks, which ones were not. What we can do with the data is to plot the case rates, the hospitalization rates over time, and mark when schools were open and when schools were closed during the time that these COVID cases were happening. So that's how we get the data. So at that level, at population level, looking at the data globally like that, there doesn't seem to be a correlation between when schools opened and changes in the trends of the data. So the curve in the cases in children follows very closely the one in the adults. They're just lower in height because we have fewer cases in children. So that's where we get this conclusion.
Doctor, children don't seem to be getting as ill as adults, but are they just as capable or just as likely to be transmitting the virus to adults, which would be of some concern for parents and teachers?
So generally, as a group, children are less likely to get COVID when they are exposed to it. They are less likely to develop symptoms when they have COVID. They're less likely to have severe symptoms that warrant hospitalization, and they're much less likely to die from COVID when they have it. Having said that, that effect that we see in children is not the same across all the age groups. So it's age dependent. So the likelihood of getting COVID and symptomatic disease and severe disease, just as like in adults, it also increases with age among the children. So with younger children, less likely to generally transmit COVID when they have it compared to older teens. So we have not done our own studies here in South Africa looking at transmission in children, but studies that were done in Korea and other countries showed that children under the age of 10 were less likely to transmit COVID, whereas older children were as likely as adults to transmit, especially your older teens, 15 years and above, 12 years and above. And you see in the other countries, they have started vaccinating older children for that reason.
Doctor, this may be beyond your purview, but why do you think that is? Why are little ones not getting as sick as late teens and adults?
So it has to do with the biology and how COVID is transmitted. As you may know from other studies and reading and other interviews, that the SARS-CoV-2 virus that causes COVID is latches onto the ACE inhibitor 2 receptor, the S receptor, angiotensin converting enzyme receptor in the body. So in children, the density of those receptors is lower in their respiratory system and in their blood vessels, and so that's why they're less likely to acquire COVID when they're exposed, but also to develop systemic disease like in adults where you have other organs involved not just the respiratory system. So it has to do with the receptors. So that density of receptors increases as children get older. It also has to do with the maturation of the immune system. Our immune systems are a little immature in children, so they're less likely to overreact when they meet the virus compared to what the immune systems have done in adults.
Dr. Kufa-Chakeza, you've definitely taught me something today, and I'm sure all our viewers watching. Thank you so much for joining us.